Well, hi, everybody. My name's Elyse Kornhauser, and I had the privilege and pleasure of completing my practicum with the Healthy Schools program at Island Health, one of the 5 regional health authorities in British Columbia. And today I'm going to be discussing my culminating report work, which involves synthesizing literature to prepare for a project that would be a youth-led social marketing initiative promoting mental wellness for youth on southern Vancouver Island. Now, before I get into it, I'd like to acknowledge that I'm an uninvited guest living on the unceded Coast Salish territory of the Lekwungen and WSÁNEĆ peoples. Now, the pictures here, you can see the one on the left is of the views from Trafalgar Park, which is traditional Lekwungen territory, and the one on the right is from the top of Jocelyn Hill, so that's traditional WSÁNEĆ territory. I feel very lucky to be able to live, work, and play on this magnificent land. So like I said, I did my practicum with the Healthy Schools program at Island Health. And what they do is they work to promote the health of children and youth on Vancouver Island in school and community settings. To do this, Healthy Schools uses an upstream population health and community development approach, where they work to build capacity and support community-led efforts to promote youth health. So this involves primarily a liaison role, partnering with schools, school districts, local governments, youth groups, and nonprofit and community organizations. Now, in my practicum with the Healthy Schools program, one of the projects I undertook was assessing the impact of COVID-19 and the associated restrictions on youth mental health. And in response to the impact of the restrictions, we decided to plan to create a social marketing project that would work towards addressing the issue and would be youth-led. Now, my culminating report was a collection and breakdown of the background information that would be needed for the Healthy Schools team to initiate and embark on a youth-led social marketing project to promote mental wellness for youth. For this presentation, because of the time limitations, I'm going to focus on just a couple elements of it, and that's social marketing and then youth engagement. So the first element I'm going to be talking about is social marketing. So social marketing can be defined as the adaptation of commercial marketing technologies to promote to programs designed to influence the voluntary behavior of target audiences to improve their personal welfare and that of the society of which they are a part. It can also be defined as a process that uses marketing principles and techniques to change priority audience behaviors that will benefit society as well as the individual. So essentially, social marketing takes tools from its 2 parent disciplines, social sciences and commercial marketing, and uses those to create change for social good. Social marketing uses a deep understanding of the people it's targeting to create an intervention that will motivate those specific people to change their behavior. So here we can see the defining features of social marketing. So at the bottom, we have the consumer orientation, which is the foundation of any social marketing initiative. Now, the term consumer orientation comes from commercial marketing, but essentially what it means is gaining a thorough understanding of the perspectives of the consumer. So in social marketing, that's the priority group that you're going to target. And all decisions in developing the intervention need to be based on their values, their wants, and their needs in order to be effective. So consumer orientation is the foundation, and it works with these 7 additional elements or pillars here to make up a social marketing approach. The first one we can see is behavior. Social marketing aims to change people's actual behavior, not just their knowledge, attitudes, and beliefs. Second, we can see theory. So social marketing uses behavioral theories and theories of change to understand behavior and inform the intervention. Insight is essentially about using the consumer orientation, learning about the target audience, what they value, what motivates their behavior, and what are the barriers to action, and then applying what's learned to behavioral theories. An important part that comes with this is segmentation, or breaking down the target population into subgroups that have similar values, beliefs, needs, and circumstances. The intervention can then be tailored to specific subgroups. Now, this helps to make it more effective rather than if we were to use a one-size-fits-all approach. Another hugely important pillar of social marketing is the concept of exchange. Now, this is about recognizing that individuals' behavior is heavily impacted by the costs and benefits that they perceive there to be. Exchange theory argues that in order for an individual to change their behavior or adopt a new behavior, they need to feel that the benefits of the new behavior outweigh the costs. So because of this, social marketing interventions attempt to maximize the benefits and minimize the costs in order to create an attractive offer. It's also important that they consider what other behavioral options will be competing with the behavior being promoted. Social marketers need to make the proposed action become more attractive than its competition. Now, the last feature of social marketing is its methods, which are called the marketing mix. And it has 4 elements or tools. So that's product, price, place, and promotion. Now, these 4 tools are used together to frame a desired behavior in a way that makes it more desirable to the group while reducing perceived barriers and then communicating this to the target group in a persuasive way. So bringing it back to mental health, there are many different ways that social marketing could be used for this, targeting different groups. Social marketing efforts could work towards encouraging school districts to put more funding into school-based mental health supports for students, for example. Or it could be used to help convince politicians to pass legislation providing free counseling and other supports for youth. Or it could also be used to reduce mental health stigma within the broader community. And those are just a few ideas. Here I'm now going to show you a couple examples of ways that social marketing has been used to promote mental wellness and reduce substance use. So the first example, the Act, Belong and Commit initiative is from Australia. And the idea behind this was to promote mental well-being by providing more opportunities for community members to get connected to each other and the community more broadly. The initiative targeted local organizations, so that was their target population, to encourage them to hold more family and community events, and also to collaborate with other community organizations to offer other activities that would promote connection and mental well-being. Another example that I want to show you is the Truth campaign, which targeted individuals. So what makes this teen anti-smoking campaign special is that it's based on a really strong consumer orientation. It was developed in partnership with youth, and they really made sure that the approach they took was based on an understanding of the youth, what they care about, and also why they smoke. So their research and collaboration with youth helped them learn that for many, the reason they started smoking was because they saw it as a symbol of individuality or rebellion. And those working on the campaign realized that if they were going to ask youth to give up smoking, they would need to propose another way to rebel. And so they decided that the campaign would focus on showing how the tobacco industry was lying to them and trying to manipulate them into smoking. So it would be a rebellion to not give in to the lies and manipulation of the tobacco industry. So here I'm going to show you a couple of their ads. The more recent ones have a more social justice focus. So social marketing strategies are to be used to help address mental health struggles currently experienced by youth in BC. It's important that they involve direct youth engagement, as they did with the Truth campaign. So what is youth engagement? Well, I've got a couple definitions here. My favorite is the second one from the McCurry Center in Vancouver. And they define youth engagement as the meaningful participation and sustainable involvement of young people in shared decisions in matters which affect their lives and those of their community, including planning, decision-making, and program delivery. So why include youth engagement within the development of public health efforts, such as social marketing projects? Well, youth engagement has 4 types of benefits, in addition to the benefits of the intervention itself. So the first type of benefit is for social justice and health equity. So we've probably all heard the term, nothing about us without us. right? Those who a program aims to serve have the right to be included in decisions that affect them. We might not think about it this way often, but youth are actually a group in our society that don't have the same rights that we do. Their opinions are often seen as not having as much weight or importance as those of adults. But youth are the experts in their own experiences. And efforts to strengthen and promote youth voice help to reduce the power differentials that exist between youth and the adults who make the decisions that impact their lives, putting some power back into the hands of youth. Now, I know I'm pretty much out of time, but I'm almost done. Another important point about health equity that I want to mention is that when done well, youth engagement makes sure to include marginalized and disadvantaged youth. So including the perspectives of these youth helps to ensure that programs and services consider and address inequities and barriers to access. And this helps to ensure that programs are going to meet the needs of the youth they aim to support. So also we've got benefits for the youth who are involved themselves. So for them, being included in decision-making provides an opportunity for them to have a challenging and rewarding experience, which helps to build their confidence, sense of identity, interpersonal skills, sense of voice and influence. For the adults who work with youth, working closely with the youth helps them to build skills and exposes these adults to new ways of thinking. For organizations that involve youth in their work, they also benefit from having access to new and creative ideas, enabling them to improve their youth services, as well as to build their credibility with youth. And these improvements benefit the broader community as well, and facilitate ongoing community development by supporting and building skills, passion, and engagement in the youth who are the community's future adults. So I've talked about social marketing, and I've talked about youth engagement. Well, how can they be used together to promote youth mental health? So data on best practices, specifically for engaging youth in social marketing projects to promote mental health, are very much lacking. However, the data that I was able to find on youth engagement in other public health projects or other social marketing initiatives all had very similar suggestions on how to best include youth. So for my culminating report, I put together a list of recommendations based on the prominent themes in the literature on youth engagement within health promotion. I'll just take a minute to briefly comment on these before I wrap up. So the first recommendation I provided is a commitment to inclusion and equity. Youth are a diverse population, and so there needs to be a commitment to involving a broad range of youth, including those from disadvantaged and marginalized communities. Flexibility. We need to be flexible and adapt to the needs and abilities of the youth, rather than expecting them to fit into our systems and norms. Sharing power. I would argue this is one of the most important pieces of effective youth engagement. The literature consistently shows that the most effective and most beneficial types of youth engagement are those that are collaborative and egalitarian partnerships between youth and the adult organizers, where power in decision-making is equally shared between youth and adults. And organizational commitment. There needs to be a commitment to these previous three recommendations, which requires openness to examining and possibly changing organizational processes and structures.
I'm sorry, Elyse, can I just jump in for a second? We're just running out of time a little bit. Can you just show your last slide?
Yes, I was just going to do that.
Perfect. Thank you. Thank you.
Yeah. So youth involvement in social marketing initiatives should keep all of these in mind in order to maximize their potential. And I just want to end off on a quote from an adult participant in a youth-adult partnership. They said, "It may be a steep learning curve at first, but in the majority of the time, they will rise to the challenge and sometimes exceed your expectations." I'd like to give a big thank you to my supervisor, Janelle Hatch, and the entire island-wide Healthy Schools team for all the support and the amazing learning experience that I had doing my practicum with them. Also, a huge thank you to Victoria Barr for plenty of help along the way. And also thanks to the other staff in our program and all of my colleagues for a great past 3 years.